Hi everyone, hope you're coping in these strange times. I'm just going to show you a short routine to help boost the respiratory and immune system. It can be used preventively or it can be used when someone's ill to help speed up recovery. Anyway, all you need, nice clean pair of feet. I use a bit of Vaseline. Vaseline I find is very good because it gives you a good consistent texture. Now, I'm following a protocol used by one of my teachers, a guy called Dr. Manzanares, who's based in Spain. He is a medical doctor and his life's work has been investigating reflexology from a conventional medical perspective. This is involved doing brain scans, whilst treating, doing biopsies of tissue to find out what's in the deposits in the feet. And he developed his own maps over this time, incredibly detailed maps which he used medically diagnosed people under 40, so he could map out exactly where the reflex areas are. Now the great thing about his treatment is it's very different to a lot of other reflexology treatments in that he just focuses on the areas that are specific to the problem we're facing. So I think this is probably a much easier method for people who've never done reflexology to follow. So I'm going to do a short video here. It's about 10 minutes on each foot. I'm going to show you one foot and then you can just copy it and replay it and do it on the other foot. Now the areas we're interested in, the reflex areas we're interested in, the area relating to the lung and the thymus, which is around this area here. You don't have to worry too much about exactly where it is. We're just going to work that whole area. We're also going to work this area on the top of the foot here, between the first and second toes, all the way down here, and also a little bit between each of the toes here. And then finally, we're going to work the side of the big toe. Side of the big toe relates to the nasal cavity, and this area here is the throat, the trachea, the larynx, the pharynx, and you've got the whole lymphatic system here. So by working these areas thoroughly, it gives a good boost and helps strengthen the immune system. So here we go. So we're going to do about 10 minutes on each foot, and you want to give a nice deep pressure. How does that feel?
Fine.
That's okay, not painful.
No.
So we're going in. You can use many different techniques, but the key is to really go quite deeply. I know not all reflexologists work like this, but this is a technique and a treatment protocol that I found to be very effective. So hopefully it's quite easy for one to copy and replicate. So we're just going in here, just going in quite deeply. You can use the side of the thumb, you can use the front of the thumb, you can use anything really. Now what you'll find is generally in a healthy person, these areas, they may be a little bit sensitive, but generally not that painful at all. But if someone has got a cough or some bronchial problem, then you'll find that maybe some of these areas are a little bit sensitive. And these are the areas you really want to work. Now, I know people generally don't have enough time to do these sort of treatments, but I think we're entering a slightly unusual time wherein, in fact, people will have an awful lot of time. So what I'd suggest is if you could do it every day on whoever you're stuck in the house with. Couple of things that have to be noted. With children, their feet are obviously a lot smaller and their attention spans are obviously a lot shorter. So really probably 5 minutes on each foot is enough. But any treatment is better than nothing, and with elderly people you probably want to reduce the pressure a bit. Is that okay? A little bit sensitive there?
A little bit.
Okay. So this is the lung area. So where it is exactly is where the phalanges join the metatarsals, just underneath there. And this bit here is a very important point for the immune system, just in here, relates to the thymus, and sometimes you can feel a bit of a bump in there. Anything there, that little bit sensitive? No?
That's fine.
Great. That's what we want to hear. So that's that area. Now I'll move across to the front. So it's slightly different. You've got that channel just down there between the first and second metatarsals. You can go in like this, going in against the bone, making sure you don't miss anywhere. How's that feel? Okay?
Yeah.
Now you don't have to worry too much about exactly where the reflex areas are, but I will do a very short video showing you where they are, and I'll post that just after. So here we go. It's quite good. You can just use your fingers to go down these channels, just very small movements, quite firm pressure. And actually you can often work the top of the foot and the bottom of the foot at the same time. Now we're going to move to the side of the big toe. This relates to the nasal cavity. This often it can be quite sore, particularly in cities when there's a lot of pollution. So you can either use tip of your thumb, slide along. The good thing about Vaseline is it enables you to slide. If you don't put too much, you can slide slowly. You can also use your knuckle, like so. Just going to check how we're doing for time. Got about another 4 minutes, so we've done pretty well. Hopefully you can just copy what I'm doing. I think sometimes just post a map of what reflexes to work, and no one really has an idea how to actually work them or what sort of pressure. I mean, how does the pressure feel to you? Is it, you can feel it? Is it firm enough, or is it like, how would you say?
Very firm.
Very firm.
Yeah,
Okay.
yeah,
Well, hopefully, is it uncomfortable?
The toe one is sore.
It's a bit sore, this one, but
Yeah.
is it bearable sore?
Bearable, yeah.
Okay. You don't want it to be excruciating at all, but the degree of discomfort is fine. Obviously, children are a lot less tolerant and understanding of pain, so maybe reduce the pressure for them, and of course for the elderly. There we go, and then we go back to the sole again. You can do thumb walking if you want, but that actually can be quite difficult, so also good way is to extend those toes and just go in there like that. Can you see? You can also use your knuckles. Go back to the top, do a bit of alternating. Now we've just got a couple of minutes left, so going back to the top, course, you don't have to do this as fast as I'm doing. And we're just going to zoom in now on the maps themselves. You've got 3 joints there. You've got the side of the foot, side of the big toe, which is the nasal cavity, and the olfactory nerve. You've got the plantar aspect of the foot, which is the sole of the foot, which has the lung, thymus, trachea, and then on the top of the foot you've got the pharynx and larynx and the tonsils, etc. Nearly done. Now Dr. Manzanares, he usually stipulates 5 minutes on each reflex area, but I think that's just too complicated. I think just 10 minutes on each foot, will really be a great help for your immune system in keeping these illnesses at bay, and if you do happen to get them, speeding up your recovery. So we'll just do one last bit going across the bottom there. Really get into that between the first and the second toe, up on the top. And just a last painful bit down the side of that big toe. And there we go. That's it, and then just repeat for the other foot. I hope you find that helpful. Good luck everyone. Stay healthy.